Hi, my name is Lauren, and I'll be completing my health assessment on my volunteer patient. I understand that you're here for a physical. Is it okay if I complete a comprehensive assessment on you?
Yes.
Can you tell me your name?
Dwayne Session.
And your date of birth?
5/13/87.
Okay. Do you have any medical issues or medications that you take at this time?
No.
Okay, so now I'll be checking your vital signs. I'll be placing the cuff around his arm. And I'll be checking the blood pressure. I'm going to pump it up slowly and release the air. Listen with my stethoscope. Checking the brachial pulse. All right. Blood pressure 120/80. Now I'm going to check the radial pulse. I'm going to assess for 30 seconds and multiply by 2. Okay, I got 68. His pulse is regular, non-thready. Now I'm going to assess his breathing, and I'm also going to multiply that by 2 for 30 seconds. Respiration 18. It's non-labored, even. Are you having any pain right now?
No.
Okay. Can you tell me your height and weight?
6'1", 210.
All right. Now I'm moving on to hands. Now I'm going to assess both of your hands. I'm looking for warmth of the hands. Any swelling, any if they're dry or moist. I'm looking at the nails for nail ridges. I'm looking for clubbing of the fingers, any yellowness or thickness. I'm also checking capillary refill. Less than 2 seconds on that hand. Less than 2 seconds on that hand. His color is consistent with his ethnic background. There are no lesions or sores. His skin is smooth texture. His texture, non-tinting. Now I'm moving on to head and face. I'm going to assess his scalp and his hair. I'm going to palpate, and I'm looking for any lesions, any lumps, any scaling, any evidence of trauma. Do you have any tenderness or pain, any issue with your head?
No.
Okay, now I'm going to assess cranial nerve number 7. Can you frown for me? Smile. Can you show me your teeth? And puff out your cheeks. Okay. No abnormality seen. I'm looking for any weakness, no involuntary movements, and it's symmetric. Now I'm going to check eyes. I'm looking at the eye structure. I'm going to be looking for even hair distribution between the eyebrows and the eyelashes. I'm looking for any lid lag, any crusting, any discharge. I'm looking for symmetric between his eyebrows and eyelashes. There is no jaundice. His sclera is white. No lesions, no redness. Have you ever had problem with your eyes?
No.
Okay, now I'm going to shine a light to assess pupils. Okay. I'm assessing for size. If they're equal and round, they are equal, round, and they react to light. Now I'm gonna, the pupils are 4 millimeters at rest on both left and right, and 2 millimeters constricted on both left and right. Now I'm gonna check for accommodation. Can you look at the light as I bring it towards you? Okay. His eyes are accommodating. Now I'm going to test cranial nerve number 2, assess for confrontation. Okay, cover this eye, this eye, this eye, yeah. Okay, and let me know if you can see my hands, my fingers.
Yes.
Okay, cover this eye. Okay. Cranial number 2 is intact, no abnormalities, and full confrontation. Now I will assess the extraocular eye muscles. I need you to follow my finger with your eyes without turning your head. Good. Extraocular muscles are intact. Now I'm going to assess his corneal light reflex. I'm going to shine the light in your eyes one more time. If you could focus on the light for me. I am assessing to determine if reflex is present and symmetrical. Now I'll be moving on to the ears. I'm going to be palpating the ears. I'm looking for any drainage. I'm looking for any tenderness, any lesions. Are you having any ear issues right now? Any ringing of the ears?
No.
Do you have any pain?
No.
Do you wear hearing aids?
No.
Okay, the ears are intact and appears normal. Now I'll be moving on to the nose. I am assessing the external nose. I am looking for symmetry, drainage, or redness. I see no deviation. Any tenderness or any issues with your nose, any pain?
No.
Okay, now I'm going to be testing for patency of the nostrils. Can you place one finger on one side of your nose to sniff for me? Other side? Do it feel patent?
Yes.
Okay. Do you get any nosebleeds at all?
No.
Okay, good. Now I'm going to be moving on to the mouth and throat. How many times a day do you brush your teeth?
Twice.
Okay, do you floss?
Yes.
How often?
Every day.
Okay, and when was your last dental visit?
2 months ago.
Okay. And you already have your follow-up dentist appointment scheduled? Okay,
Yes.
good. Do you have bleeding of your gums or anything? Any bleeding?
No.
Okay. I'm going to check your mouth, tongue, teeth, and gums. I'm going to use my pen light. I'm assessing his mouth. I see his lips are pink. I see his, I'm going to be assessing his tongue, assessing the color. I see it's moist. I'm looking for color and moisture. His teeth are not discolored. I don't see any caries. His gums are not red or swollen. No bleeding on it. His tongue is pink and not swollen and moist. I'm going to now assess cranial nerves 9 and 10 and uvula to make sure that's intact, and assess midline. Open up for me. Okay. This is my tongue depressor. Okay, the uvula rises easily and is attacked in midline. I will also assess gag reflex. Okay. Now I'll be moving on to the neck area. I'm going to assess the neck. I'm going to be palpating for any tenderness, any lesions, lumps, any issues with your neck, any tenderness or pain.
No.
Okay, I'm going to be assessing the carotid pulse, one side at a time. Pulses are palpable. I'm going to be assessing the trachea in the midline. Okay. Now I'm going to be checking range of motion and muscle strength, assessing cranial nerve number 11. Can you move your head up and down? Very good, side to side. Can you press against my head? Very good. Other side. Up. Very good. And back. Very good. Can you shrug your shoulders? Very good. He has full range of motion with his neck and can shrug his shoulders. Cranial number 11 is intact, equal and full strength. Now I'm going to be checking posterior chest and lungs. Can you turn around, please? Now I'm going to be assessing the thoracic cage. I'm feeling the thoracic area for symmetric and no use of accessory muscles, no barrel chest. Can you deep breathe in for me? Very good. Symmetric expansion. Any pain or tenderness?
No.
Okay, now I'm going to assess for tactile firmness. When I put my hand on you, I need you to just say 99, okay?
99, 99, 99, 99, 99, 99.
Okay. No lumps or tenderness is present. Now I'll assess costovertebral angle for tenderness. I'm going to now be assessing the CVA for tenderness. I'm going to be putting my hand on the 12th rib. Any tenderness or pain?
No.
Okay, now I'm going to listen to breath sounds. Breathe in. Okay. Now I'm going to be assessing the I was listening for any diminished breath sounds, any bronchi, any crackles, any wheezes. His lungs are clear in all fields. Now I'm gonna be going to the anterior chest and lungs. I'm gonna be doing the same thing. I'm going to be checking the thoracic cage for any use of accessory muscles, no barrel chest. Can you breathe, please? Symmetric expansion noted. Any pain or tenderness?
No.
Okay. I'm going to be assessing for tactile firmness. Say 99 whenever you feel me.
99, 99, 99, 99, 99, 99.
Now I'm be listening to anterior breath sounds. Okay. Breath sounds are clear in all lung fields. No rhonchi, no crackles, no wheezes. Now I'm gonna be moving on to the heart. I'm gonna be checking the apical pulse. I'm going to palpate it first. Now I'm going to listen in the same spot to the apical pulse for 1 minute. Okay, I listened to the apical pulse for 1 full minute. His rate is 70 and it's a regular rhythm. Now I'm gonna be listening to S1 and S2. No murmurs heard. Now I'll be assessing the upper extremity range of motion. Can you place your hands out to the side? Okay, raise your arms over your head and out in front. Cross them, other way. Bend your elbows and straighten them. Okay, turn your palms up to the ceiling, now down to the floor. Squeeze my hands. Good, don't let me press down and don't let me press up. Very good. He has full range of motion, equal strength bilaterally, strong in both left and right. Now I'm be checking the brachial pulse and radial pulse. Radial pulse 2+. Brachial pulse 2+ also. Go to the other side. Radial pulse 2+. And brachial pulse 2+. Now I'll be checking the neck vessels. Now you have to lay down, please. Okay. I'll be observing his jugular veins for JVD. And turn that way. Other way. Okay. No distension noted. Now I'll be checking his abdomen. First, I'm going to inspect his abdomen, and I notice that it's round, flat, no masses, no bulging, no pulsation. His umbilicus is midline and inverted. Now I'm going to be listening for bowel sounds. Bowel sounds are present in all 4 quads. Now I'm going to palpate, starting with light palpitation. I'm looking for bulges, masses, or tenderness. Any pain?
No.
Okay, no tenderness.
No.
His abdomen is soft with no masses. Now I'll be going a deeper palpitation. Okay, no bulges, no masses, no tenderness, any pain or tenderness.
No.
His abdomen is soft with no masses. Now I'm going to be percussing his abdomen. Tympany, no dullness noted. Now I'm going to be assessing his lower extremities. Now I'm going to be checking the lower extremities. I am assessing his lower extremities. I'm looking for symmetrical color. The color is appropriate for his ethnic background. No lesions noted. Hair is evenly distributed. I'm assessing for toenails and abnormalities. I'm assessing capillary refill. It's 2 seconds and brisk on the right foot, and 2 seconds and brisk on the left foot. I'm also checking for the skin, and the skin is warm and dry, and no edema noted. Now I'm going to be assessing his pulses. I'm going to start with the femoral artery, femoral pulse. 2+. 2+. Now I'm going to do the popliteal, which is behind the knee. 2+. 2+. Now I'm going to be doing the posterior tibial. 2+. And 2+ to the right. And now I'm be doing the dorsal pedis on top of the foot. 2+. And 2+. Now I'm going to be assessing the hip. I'm going to be assessing the musculoskeletal, his hips. I'm looking for any pain, any tenderness, and then I'm going to be doing range of motion. Do you have any pain or tenderness in your hips?
No.
Okay. I'm also feeling for crepitus or instability or. Now I'm going to have you flex your hip. Can you lift your leg up to the ceiling? Yep, and that one. All right, now bring it out. Okay. And then now I'm going to have you bend your knee. And then I'm going to do internal rotation. Okay, and then X out. Okay, any pain?
No.
Okay. Normal range of motion. Now I need to do the other hip. Okay, that one. Right. Okay. In and then out. Any pain?
No.
Okay, patient has normal range of motion. Now have to assess your ankles. I'm looking for any swelling, any ulcers, any redness, any edema. Do you have any pain in your ankles?
No.
Now I'm going to test your ankle strength. I need you to point your toes down. Okay, up to the ceiling, dorsiflexion. Now toes out, eversion. Out. Very good. And then in. Now I need you to pull. All right. And then don't let me push down. Very good. Range of motion is normal and strong. Okay, can you sit up for me now? Okay, now I'm be assessing the deep tendon flexus. I'm going to be using my spoon as my my spoon as my tendon reflex prop. So I'm going to be testing for the bicep. Okay. Other side. Now I'm going to be testing the tricep above the elbow. Okay. Now I'm gonna be testing the brachial radialis, the top of the hand. And then the patellar. And then the Achilles. Now I'm be assessing his sensation. I have a Q-tip, the top for soft, and then the bottom I have for the sharp. I'm gonna be assessing your sensation. Tell me if you can feel this. I need you to close your eyes and tell me if it's soft or sharp, okay?
Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft.
Your feet, hold your feet up.
Sharp. Soft.
Okay, sensation is present. Do you mind standing up for me? I'm going to assess your spine. Okay. Can you touch your toes? Okay. Spine is symmetry. It's intact. In the range of motion, the spine is normal. No abnormalities. Any pain?
No.
Okay, stand up. Okay, I'm assessing further range of motion. Can you lean to the side? The other side. And can you bend backwards? Very good. Any pain?
No.
Can you do a shallow knee bend for me? Back up, please. Like this. Shallow knee bend. Okay. I'm assessing for symmetry and range of motion by having him slightly squat. Any pain?
No.
Okay, can you walk normal from right here? Heel to toe? Normal. Okay, now can you walk? He has appropriate coordination. Now can you walk on your tippy toes? Okay, now come back, and now I need you to walk on your heels. Very good. He has appropriate coordination. Anything else do you feel we need to know?
No.
Okay, I want to thank you for coming in today and having me complete this head-to-toe assessment. If you have any issues, I advise you to please follow up with your primary care physician, okay? Okay, thank you.